Hi, I'm Nurse Kristen and I'm the Nurse Aide Training Manager at Lunder CareForce Institute. In today's video, I'm going to demonstrate medical hand washing using soap and water and also using an alcohol-based hand sanitizer. We should always be washing our hands before we're entering a person's room and when we're exiting, and any time during a procedure that's needed. We also should be sanitizing our hands prior to putting on gloves and when we're removing gloves. When do we know when we can use soap and water versus as alcohol-based hand sanitizer? Well, the first thing I want you to always do is take a look at your hands. If your hands are visibly soiled, you're always going to elect to use soap and water. If not, you certainly can go ahead and use an alcohol-based hand sanitizer, but please use soap and water after several uses. Hand washing is the #1 way that healthcare professionals can help to prevent the spread of infection. And let's go ahead and watch how we're going to do that for our patients. I'm going to start off my hand washing skill by rolling up my sleeves for my uniform and pulling up my watch about 4 inches on my wrist, making sure that I'm exposing my entire wrist. Then I'm going to turn on the warm water. I'm going to check the water temperature, making sure it's warm, and making sure I'm not touching the sink area with my uniform. Then I can go ahead and rinse off my hands, wet them completely up to my wrist. And I can grab some soap. We're looking for about a dime size amount of soap. You can start rubbing your hands together to form friction, making sure that you're getting all surfaces between your fingers, the backs of your hands, and your wrists. If your fingers or your nails are visibly soiled, you can use an orange wood stick to clean underneath them, but we can use friction because mine are not visibly soiled. So I'm going to rub the fingertips on the opposite hand. And this process in all should take at least 20 seconds. So you can sing the happy birthday song twice, and that should equate to about 20 seconds. All right, and now when you're done rubbing your hands together, making sure that you have all surfaces cleaned, you can start to rinse, making sure that your fingertips are facing downward towards the sink. Nice and gently, you're going to rinse, making sure that you clean off all surfaces, and careful not to touch the inside of the sink. If you were to do that by accident, then you would contaminate your hands, and then you would just have to repeat the process. Now you're going to avoid shaking your hands and just let them drip for a moment. And you can go ahead and retrieve your paper towels and start patting all surfaces of your hands dry. Immediately discarding the paper towels in the trash can, making sure that you don't touch the trash can. I have a foot pedal trash can that opens up, so that's a good option. Making sure that in between your fingers are all dry. Now I'm going to take another piece of paper towel and I'm going to shut the sink off. So I'm going to make sure that I hold onto the levers with my paper towels, not to contaminate my hands. Throw those paper towels directly in the trash. And if I were to need to open a door or a doorknob, I can do the same thing with a paper towel, and then I can open that doorknob and immediately discard the paper towels. If your hands are not visibly soiled, you can use an alcohol-based sanitizer. Start off by pumping 1 pump into the palm of your hands and start rubbing your hands together using friction in the same motion that you used when you were washing your hands with soap and water. Now making sure that you're getting your wrists, the backs of your hands, in between the fingers, and the fingertips. Now you're going to completely cover your entire hands with the sanitizer and continue to rub them together until the sanitizer has completely dried. And once your hands are completely dry, you can move on to the task that you are about to do.